Sorry about that. I got called to a meeting. I'll continue though. So we got through the ethmoid bone and the importance of cribriform plates, cristagalli, and what they do. Let's go to the mandible. It's U-shaped. Lower jawbone, it's the only free bone. It's the largest, strongest bone found on the face. It forms your chin. It has two rami. These are the things that are going to meet and make the mandibular angle. Mandibular foraminea, those are the little teeny tiny holes. If we're looking at our skull again, look at the mandible and see if you see these teeny tiny holes. Those allow nerves to come through. Think about it. When you go to a dentist and you're having some lower teeth work, they're going to be able to give you a shot by aiming for where these holes are and where the nerves are coming past. Because if they hit the nerve, they deaden the area. So you have no sensation.
Okay.
Maxillary bones, they're going to be fused medially. So your maxilla is going to be the top one. It's not one bone. That's a common misconception. It's two bones that fuses in utero, and you can actually see where it fuses in the skin by this area here. And then you can also check right there, and you can see where it fuses as well. Okay. It has the palatine process on the underneath of it. It's going to be making up 2/3 of the hard palate, the roof part of your mouth. It's just posterior of the teeth is the midline. Okay. And you're going to have foramen in that area. Those foramen, okay, are going to be areaways for nerves and blood to pass through. The hyoid bone, which is going to be found just here, not truly part of the skull, but it's considered part of the axial portion. It lies below the mandible, the only bone that does not articulate with any other bone. It's anchored by a narrow ligament to the styloid process of the temporal bone. It raises and lowers the larynx during swallowing and speech, and its main function is an anchoring structure for your tongue. Vertebral column, read about it, talking about how many irregular bones there are, the 5 major regions. Okay. On my PowerPoint, you can see that I talk about scoliosis, kyphosis, and lordosis. All 3 are defined in your book fairly well. They're disorders of the spine. Make sure you know those. Spinal ligaments. Well, obviously, we have to keep the vertebral column in place because it carries so much weight. These ligaments are cable supporters. There's going to be short ligaments. They're the ligamentum flavum, which connects adjacent vertebra. And then there's going to be larger, major supporting ligaments that run up and down the entire length of the vertebral column. It helps for motion and movement. Think about all that you do and the impacts that you have. This keeps them in place without motion. Intervertebral discs, those are cushioning pads. These cushioning pads have 2 parts. The inner nucleus pulpus, it's gelatinous, and it allows for elasticity and compressibility. The outer is going to be composed of collagen fibers, giving it strength so the nucleus doesn't explode. Okay. Structure of the vertebra. Okay, look at the image that I have as far as the structure of the individual vertebra. They each have the same thing with a process, a vertebral arch, a body, ligaments, positioning. Okay, make sure you know that. First and second cervical vertebra are special. They are the only ones that are specifically named. Okay, the first one is called atlas. There's no spinous process and no body. This second one is called axis. It has body and process, but it's not as specialized as the rest of the vertebra as you go down. Okay? The first one holds the vertebra in place, so I'm talking about atlas, and gives it the ability to nod. Okay? And that's nod, yes. Okay? Axis is specialized in, well, it acts as a rotation with atlas to say no. Unique features. You think it's something nothing, but when you have the inability to do something like that, you learn. I just had cervical fusion added to my fusion that I've already had, which is a scar over here. Now I have 4 levels fused. I've lost range of motion. It does make a difference, I can tell you. Talk about the different vertebrae and where they are. Okay. The sacrum, that's at the base of the spinal cord. It's 5 fused vertebrae. Okay. It has the coccyx on it. It is going to be anterior. It basically doesn't have a true use except for the little holes that are found, the foramen up and down it, and that's where nerves to go in and out of. Thoracic cage, that's going to be the vertebra, the thoracic vertebra, the ribs, the sternum, and the cartilages. Okay? Costal cartilages secure ribs to the sternum. It protects the lungs and heart and large blood vessels. Okay? Sternum, which is that 6-inch long flat bone found in the front between both sets of ribs. It's midline. It's formed by 3 bones that are fused. Manubrium, body, and xiphoid process. The ribs, you have 12 pairs of ribs. They're going to attach at the thoracic vertebra. There's 7 superior ribs that are going to be called true ribs, 5 pairs that are false ribs, and then ribs 11 and 12 are deemed floating tibs. You can tell they're true ribs because the rib goes bone, cartilage, sternum. There's no in between. When you're looking at the pictures, you'll see what I'm talking about. Now if you look at a false ribs, it'll go bone, which is the rib, cartilage, attaches to another piece of cartilage, and then the sternum. That's what makes them false. All right, let's move on to the appendicular skeleton. Okay. The pectoral girdle is going to have your clavicle and scapula. Clavicle is also known as your collarbone. It's S-shaped. Okay. There's a medial sternal end. It attaches to the manubrium, and a lateral acromial end that articulates with the scapula. It anchors many muscles, so that's its function. It also acts as a brace, and it transmits compression force. Okay? The compression force can be from either side, the sternum or the scapula. Weird shaped bone, and you not think this, but it's very easy to fracture. The scapula is a triangle shaped bone, flat. There's 3 borders on it, superior, medial, and lateral, and it's going to articulate with the humerus. Your arm, you're going to find your humerus, which is your long bone. It's going to articulate with the scapula and radius and ulna. Just think of all the things it touches for articulations. Proximal is the head, round, fits in the glenoid cavity of the scapula. Distal end, there's 2 condyles, the medial trochlea and the lateral capitalium. These are what articulate. Your forearm has 2 parallel long bones. The ulna is slightly longer. It forms the elbow joint with the humerus. It has two processes, the olecranium, which is the elbow, and the carotid notch fits with the humerus. Okay. Radial, the notch also articulates, okay? It's thin, its proximal end is wide, and fits with the opposite end of the ulna. The head is round like its name, the radius. How to remember it is the radius makes a circle. In a circle you have a radius. It looks like that, okay? It's going to have radial tuberosity to anchor the biceps of the arm, and it does contribute to the wrist joint. Your hand, it's going to have your wrist, palms, and fingers. Wrists are called carpi. Okay. Carpals are 8 short bones, very flexible because they glide past each other. Remember, they're that square shape. They're 2 rows of bones. Okay. If you're looking at the 2 rows of bones, if you utilize this acronym, it'll help you in lecture and in lab in memorizing these bones. Okay. Sally left the party to take Cindy home. Sally left the party to take Cindy home. If you're looking at the bones named either in the book or in the PowerPoint, scaphoid, lunate, tricarbonate, pisiform, row down, trapezium, trapezoid, capitate, haminate. There's where you get the acronym. Metacarpals will be your palm, very small, long bones. They're not really named, but they're numbered 1 through 5, and it always starts at the thumb as number 1. Okay. The very ends are called phalanges. They're named as well, 1 through 5, but you have to also include proximal, middle, and distal for phalanges. So it would be like 2 middle, 3 distal. Those are the names that I'm looking for and what you're supposed to do when you're naming this area. Let's work our way down. Pelvic girdle, okay? That's going to attach the lower limbs to the axial skeleton. It's going to passing total weight from the upper body towards the hip socket, okay? Girdle's going to form the sacrum. It's a paired hip bones. Each hip bone has 3 separate bones joined together, the ilium, ischium, and pubis. There is a deep hemispherical socket called the acetabulum on each lateral surface of the pelvis. Okay. The ilium, large bone, superior region of the pelvic. It's when you put your hands on your hips, you're putting your hands actually on your ilium, specifically the iliac crest. The ischium is the posterior inferior. It's a much thicker body. It's the lower portion of that harp shape meeting at the symphysis. I always said, and what I remembered a very long time ago when I took A&P, ishy squishy, if you're sitting on it, you're sitting on the bones that would make up the ischium. Okay. Important marks that you need to know of the ischium spine, ligaments to the sacrum, the lesser sciatic notch, blood vessels and nerves, and ischial tuberosity, weight bearing. The pubis, which is the last bone making up the pelvic girdle, is the anterior portion of the hip bone. The anterior bladder rests on it, and it makes a virtual V with the pubic symphysis. Okay. Difference between male and female bones. Size, thickness, weight. Obviously, the bigger, the more it's going to be a guy. Right. The big thing is that pubis that we were talking about, look at the pubic symphysis is where the two bones meet. I can't get this thing. Okay. The pubic symphysis is where they meet here. Underneath that area makes a V. The idea is you want to put your fingers in there. If it's less than a 90-degree angle, it's a guy. There's no way he can push out a baby. If it's greater than a 90-degree angle, which I'm showing to you, that's a woman because she can push out a child. That's a really great check. Last bit is the bones of the legs. So in the thigh you have the femur, single bone of the thigh, largest, strongest. It actually can hold up to 2 tons per inch. That's a very strong bone. It articulates with the pelvis, then with the knee. The head is the ball. Okay? It's going to help be secured in the acetabulum of the hips. The neck is the weakest part if you're looking at the image. Distally, it has a medial and lateral condyle to articulate with the tibia. The patella is a portion of the knee. It's a sesamoid bone. It's round and flat. I mean, literally looks the size of a quarter. It's enclosed within your quadriceps, which are your muscles. It secures the anterior thigh muscles to the tibia, and it protects the knee joint anterior and improves the leverage of the thigh muscles that actually go across the knee. The tibia, shin bone, receives weight from the femur and then transfers it to the foot. The proximal end has medial and lateral condyles. And you have tibial tuberosity, which is just below the top portion of it, the superior portion of it. You can feel it feels rough. If it's rough, that offers a place for ligaments to attach. Fibula, it articulates proximally and distally with lateral portions of the tibia. The proximal is the head, the distal is the lateral malleolus. That's that comes down like this. I'm trying. There you go. And that's what helps form your ankle. Okay. I talk about fractures. Specifically, there's one, a fibula fracture. It's called a Potts fracture. It's a sports injury, and it's down at the distal end when it happened. And it's one of those kind of things that you've got cleats on, you're running in grass, let's say soccer, run forward, and then you have to quickly turn and go the other way. Can have a Potts fracture. Your feet, there's the taluses, metatarsals, and phalanges. Tarsus are 7 bones. Then you've got the calcaneus, which is your heel. Okay. You've got metatarsals, 5 small long bones. Again, 1 through 5, starting at the big toe. Phalanges numbered 1 through 5. Again, you're going to have to number 1 through 5 as well. And then notice that the great toe, which is also called the hallux, only has 2 parts. It doesn't have 3, so it's proximal or distal. Arches I talk about need to arch to hold weight. There's 3 arches, 2 longitudinal and 1 transverse. It's mainly made by how your bones fit together. Talus is the most important in making this arch. Lateral longitudinal arch, it's low. It elevates the foot to redistribute weight. Transverse arch runs obliquely from one side to the other. And medial longitudinal arch, it curves in deeply. Those of you that really like to wear high heel shoes. talk about brittle bone disease. Look at those images to freak yourself out a little bit. Read about it. Skull of a newborn. I talk about how they ossify late in the second month. That when they're born, you have those soft spots called fontanelles, which allows for brain growth. Okay. You also talk about cleft palate, because I think that's a disorder that you should talk about. People deal with it. That's where these don't fuse together properly while in utero. You can have it not fuse on one side, and you can have it not fuse on the other side as well. So it can be bilaterally or just right or left. If it doesn't fuse up here, it doesn't fuse here, and it doesn't fuse here. So then you're going to have a problem with your palate not fusing. You're going to have a problem with your teeth not being made and the gums not fusing together, and then your outside area not fusing together, causing a problem to your nasal cavity as well. A lot of problems associated with it. Can't breathe, nasal cavity is disrupted, no teeth, you're going to need new teeth in the future. Trying to suck, you know, an infant when they're born, they have to suck. Causes a major problem if they can't suck to take in either breast milk or formula. It's all fixable. It's fixable through surgery. It's not done in one surgical event. It's done in a multitude of events. And if you watch Duck Dynasty, you know that his daughter, Jace's daughter, I think his name is, has had, at the time, he said 27 surgeries. So it gets kind of expensive. I talk about curvatures, primary and secondary, which is kind of cool. The image, you know, of somebody holding a baby like that, which, trust me, works. When you're walking around with a child like that, sometimes they stop screaming. That's primary curvature. That's the thoracic and sacral curvatures are well developed at birth. You're able to hold the baby like that without damaging, harming, making the baby upset. But secondary curvature is when you lay the baby down on like a blanket and they have the ability to lift their head. This usually doesn't come until about third month, but that's the cervical and lumbar vertebra now well developed enough to do so. So that's the difference between primary and secondary curvatures. I hope this helps. You still need to read the book because you're responsible for everything in the book. I tried to highlight on the things to help you see kind of what I'm looking for. Make sure you know the functions of the bones. What are they moving with? Okay. What is their, where are they found? What are some of the primary points that are on each of these bones? Okay. Hote. Good luck.